just give me a brief synopsis of what's going on right now?
Yeah, so last week our office received a report of a flock that had elevated mortality. So they had almost all but one of their birds in their flock had died. And we quickly launched a field team member to go out and collect samples from those birds that evening, bring them to the diagnostic lab. And we did receive confirmation yesterday, late yesterday, that it was confirmed H5N1, highly pathogenic avian influenza. So right now my team is putting together a plan. The premises that was affected is quarantined, and we have one of our field veterinarians that is a case manager and working with the owners. So the last remaining bird on the facility was euthanized. The premises is under quarantine, and they'll be undergoing a flock plan with an extended quarantine. And then my team is on our way out there right now, and we'll be doing some door-to-door outreach with folks in the area. And so our goal is to reach anybody in the area that has poultry and provide them information on what to watch for and how they can reach out to us to report if they do have any sick birds.
Okay, that's excellent. Is there anything that bird owners can do to protect their animals?
Yes. So our goal right now is to reach all bird owners, whether you're a small flock or a commercial flock, and increase biosecurity. So we know that wild birds are carrying this virus and they're spreading this virus, and that poses the biggest threat to our domestic poultry in the state. And that goes for backyard birds and commercial as well. So there's a lot of steps we can take. A few of the simple steps for folks to take is to maintain a closed flock. Don't introduce any new birds. Keep your birds indoors to prevent exposure to wild birds that are carrying and shedding the virus. And we have a lot of great resources on our website, and USDA has a Defend the Flock program that goes through very simple steps, biosecurity steps that flock owners can do to minimize the risk of highly pathogenic avian influenza to their flocks.
Okay, that's great. How concerned are you about this potential for spread?
Yeah, so I mean, to be honest, I'm really worried. I mean, we've never seen an outbreak like this with high path AI in the past, especially with this level of wild bird detections. We've had a lot of wild birds that we know are carrying the virus. They're also dying from the virus. We've had a lot of wild bird mortalities, and there's not much we can do about the wild birds. So our goal is really, we just have to protect our flocks here, and that's all up to the flock owners. So it's up to flock owners to increase their biosecurity. You know, once this disease is introduced into a flock, we can see it wipe out a flock in 24 to 48 hours. I mean, all the birds get sick and all the birds die. And there's nothing we can do. There's no treatment. There's no approved vaccination. So really, it's all about prevention. Right now, our primary goal is focusing on prevention and getting our bird owners to focus on prevention. While at the state level and the federal level, we're quickly working on increasing our response activities if we do have additional detections.
Okay. You've touched on this a little bit, but I kind of wanted to hear you talk a little bit more about, we've had wild detections before this. This is our first backyard domestic flock. Why is that so different?
Yeah, so there's a lot of different activities that have to take place when we have a domestic detection. And a lot of that is guided by USDA policy and our CDA policy, but also our international trading partners policy. So we have international trade, and when we have a detection in domestic poultry, there's a lot of downstream effects that happen. So we have to implement what's called a control area around an affected premises. And that's when we go out and do that direct outreach and make sure that all of the flocks in that immediate zone are, you know, well educated. They know what to look for. They know what to report. And we do additional surveillance in that area if we do see any reports of sick birds. You know, it's also really concerning to us for our commercial poultry operations. We have a lot of large commercial poultry operations here in the state, and all of them are working diligently to prevent the virus from getting into their flocks as well. But, you know, we really all take a part in this. This is something that everybody has a piece and we all have to work together for it.
Absolutely. Because I mean, even if you're not a bird owner, this is still going to affect you through the price of chicken, the price of eggs.
Yeah, that's right. And important to know on that, properly prepared poultry and eggs are still safe to eat. So this detection does not signal any risk to the general public at this time. You know, the risk for people is those that are directly exposed to wild birds that are confirmed or domestic birds that are confirmed with the virus. So our public health partners are working on that side, and I'm working very closely with them to make sure they have a monitoring plan in place.
Okay, that's great. One more quick question. Do you have any idea as to why you think this might have cropped up in Pitkin County as opposed to somewhere else that's a little less remote?
No, very interesting question. So what we're seeing really nationwide, so many states on the eastern states and Midwest states have already had a lot of detections of this in their domestic flocks, and that goes for both backyard and commercial flocks. We've lost over, I think, almost 25 million birds so far in this outbreak across the country. And so, you know, what we're seeing is single source introductions from wild birds. And we've got wild birds everywhere, right? So, and we can't predict when and where they're going to shed that virus. So it is really hard to say why it showed up here. And we do know that this particular flock had direct exposure to sick wild birds. They had 2 ducks that got into their coop, and one of them died in the coop. They were showing clinical signs of high path AI, and within a few days their birds started getting sick. So it's unpredictable. The pattern is unpredictable, but you know, the most important thing to know is that what we're seeing is it really shedding from wild birds. Now, the other thing that can happen is once it's introduced to a flock, if we don't put biosecurity measures in place on that premises, it can rapidly spread from that flock to flock to flock if we're not preventing that virus from moving off of an infected premises. So that's why reporting is so critical, because we'll work with that flock owner. We'll make sure that we're containing that virus to that premises to limit continued spread that would expose other flocks.
And just one quick clarification. You said 25 million birds. That's domestic birds?
That's domestic birds, that's
Okay.
correct. Yeah,
Okay.
and there have been a significant number of wild bird mortalities. I don't have the total on
Sure.
that as well.
I'm sure that would be difficult to track.
Mhm.
Okay, Dr. Baldwin, is there anything else you think people should know before we wrap up?
No, I think one thing, if you guys could share, we did host a webinar on Wednesday. It was a 2-hour webinar for backyard and exhibition bird owners. And we provided them all the great information about the virus, about the things that they can do to protect their flocks. So the more we can get that shared with all of our bird owners, the better.
Okay, that's great. Thank you so much for taking the time. I'll let you go. I know you're very busy.